work hard, play hard, work hard, play hard, work hard, play hard, work hard, play hard.
Work, 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 work. Diamonds.
Will you tell me something, Mr. Lumberjack? Is it 1 for forward and 3 for back? Is it 2 for stop or 4 for go? Boy, ask a whistle punk. I don't know. What I learned.
Welcome to our clinic. My name is Vlad. How's it going? I'm doing good. You seem to be in some pain. How are you doing today?
Man, my shoulder just hurts. I messed it up at work one day.
Okay. Well, walk this way and we'll get started. You can have a seat here. All right.
Here, the occupational therapist would perform basic assessments such as range of motion, manual muscle testing, and a pain evaluation, then a functional capacity evaluation to determine specific client deficits and needs for successful job performance.
All right, Mr. Gert. What I'm going to do now, I'm going to check your range of motion to see how much motion you have, without pain, and then I'm going to test your strength out, okay? I'm going to test both sides. That way I can compare to each side, okay?
During this portion of the pre-work hardening program assessment, the occupational therapist checks the client's range of motion and muscle strength bilaterally to compare differences and record baseline measurements. As seen in the video, testing reveals that the client's right shoulder has less range of motion and strength and more pain when compared to the left shoulder. From this point, after recording some basic assessment measurements, the therapist would begin a functional capacity evaluation with the client. An extremely abbreviated version of the functional capacity evaluation will be shown next in the video due to the lengthy process involved in performing this assessment. This evaluation can take upwards of 2 days to complete, requiring many hours of assessing the client to record all necessary pre-program measurements for the evaluation.
Headed down south to the land of the pines. I'm thumbing my way.
Now that I have an idea of where you are with your range of motion and your strength and your pain level, I'm going to take you through some simulated job activities, okay?
Okay.
So we'll start here, and then we'll just progress through the obstacles that I have set up for you.
Okay.
Okay.
Some of the many measurements included in the functional capacity evaluation will be the client's ability to manipulate objects in which he would push, pull, lift, carry, and grip them. He would also demonstrate his mobility capacities by squatting, bending, kneeling, crawling, and ambulating. These tasks will provide the therapist with information regarding the client's ability to perform typical work tasks required of a lumberjack, such as cutting and carrying, hauling lumber, driving and operating equipment, and being mobile enough to engage sufficiently with his environment to accomplish his job duties. In this video, we demonstrate Mr. Gert's ability to perform weighted carry, seated bending and push-pull, chopping, and weighted standing push. We then demonstrate simulated activities for rehabilitation in the program consisting of appropriately graded chopping, lifting and carrying, and sawing. As you will see, the client will be instructed on proper body mechanics and performance during the tasks, and will also be instructed in the same manner throughout the therapy program to reduce the likelihood of a future injury. You will notice that the client consistently has trouble with the right shoulder. As this occurs, the therapist is correcting grading the activities appropriately to ensure the client does not compensate to complete tasks. It is impossible to complete the evaluation without the client experiencing some slight discomfort due to the extensive nature of the test. Appropriate grading is necessary to reduce chance of injury, though. By the end of the work hardening program, the therapist should have addressed many different areas of improvement for Mr. Gert. These should include the client's rehabilitation needs specifically for his impairment, observing the client's task performance to provide education for safety, ensuring the client isn't afraid to return to work by explaining the similarity between the demands of work and typical demands of everyday life, guiding the client in properly grading his own work pace and work demands to prevent injury, and increasing the difficulty of the therapy to prepare the client well for returning to work.
Take this job and shove it. I ain't working here no more.
Keep it in the green zone.
Took the reason that I've been working for. You better not try to stand in my way as I'm walking out the door. You can take this job and shove it. I ain't working here no more. Well, I've been working in this factory now.
Due to correct biomechanical performance and teamwork, they were successful in completing the activity, and the patient demonstrates his enthusiasm with a gesture of excitement known as the high five. The patient is bound to make progress with his therapist exuding such client-centered, ambitious rehabilitation.
Okay, man. Thank you for getting me better. I feel like I'm good to go.
No problem.
I can chop some trees down.
You did great in this program.
Ready to roll, man. So it's been real though.
It's been a good time.
I've enjoyed it. Thank you, brother.
Patient demonstrates his thanks properly with an emotional hand hug.
See you later.
See ya. Man, I don't know what's wrong with you. This guy's good.
How are you doing? My name is Vlad.
Mr. Sutzelin,
Nice to meet you, Mr. Sutzelin.
nice to meet you. At some point during the program, the therapist is required to perform an on-site evaluation and task analysis. This will reduce the likelihood of the program team not accurately perceiving the demands of the job the client is returning to, as well as help them gauge the progress the client is making towards returning to work.
Mr. Sutzelin, you're progressing quite well in therapy now. Do you agree?
I agree.
Great, great. So our next task is to take you out into the environment to perform your work tasks, okay? So we will be planning trip to do that.
Yes. Here the therapist travels to the work site to perform a work site evaluation and ensure that the new patient is progressing in a manner that will emulate exactly what is to be performed at the work site.
Perform the activity to make modification.
Yes.
Okay, proceed. Yes. Oh, no, that is very bad. Let me show.
Why is bad?
So you want to come down, straight back. We come in, we bring it in, we drive hips, good hip, drive hips. Now you try.
That's right.
Good. Great. What is that noise? Do we need to go inspect it?
Follow me.
Let's go. Hey, who is this man? Hey man, who are you? What are you doing?
Hey, Doc.
Mr. Gret?
How's it going?
It's going great. You seem to be doing well.
I am. I'm feeling better.
Oh man.
Got back to work,
Oh man, you're doing great.
and I'm good to go.
That is great news. Work hardening. It pays off.
Will you tell me something, Mr. Lumberjack? Is it 1 for forward and 3 for back? Is it 2 for stopper, 4 for go? Boy, ask a whistle punk. I don't know.
Galoshka. Is it rolling? Galoshka. Okay. You ready? Alright. Alright, Mr. Gert. So now that I have
We're good. So how do I need to make this look real bad?
Alright. That might not be the best activity, but no. Watch me. Want the straight back. Want the firm stance. Keeping the straight back. And we drive the hips. Grab. Lift. Keep it in the green zone.
It's a 10-man. Go outside.
Zoom in on the hand, hug.
So what am I saying when I come in?
I'm just gonna be like, I'm gonna open the door and like we can see open at the same time.
Yeah, okay. In 10 seconds, make some noise like grunts. All right, and then we'll go.